Welcome, everyone. We are so glad that you are with us today at the second day of Intact System of Care Summit. We are going to get started in just a minute. And as you all are joining in this first of our concurrent sessions today, I'd like to quickly review a few items. We want to remind everyone of our commitment to maintaining a safe and accountable space. If you experience issues and need assistance, please reach out to me by sending me a direct message found at the top right corner of the event. And my name is Suki Steckel, so you can see that name and send me a direct message if you need to. To walk you through the tools in this session, I'd like to draw your attention to the vertical bar featuring several icons on the right side of your screen. If you joined us yesterday, you did see all of these and hopefully you're familiar. But if this is your first day, welcome. And please feel free to go ahead and play around with those icons. The resources can be found in the icon that looks like a stack of paper. The chat looks like a chat bubble, and the Q&A says Q&A. So those are the three main ones that you will see today. Please make sure that you only put questions in the Q&A, and that if you have chats that you want to drop in there or comments, please make sure you're in the session chat and not the event feed. The event feed will, if you're open in that, it'll cover that vertical menu bar. So just play around with that, make sure you're in the right space, and reach out to me if you have any questions. And if at any time during this session you need to step away, take a break, or debrief or decompress, please feel free to do so, and know that our wellness room is open today. So you may enter the wellness room by clicking on the wellness room button on the top left side of the event navigation bar, and a member of our team will meet you there. So now, without further ado, I would love to introduce our speakers for this session today. Dr. Gia Kelly and Cindy Rivera are two of our wonderful Intact partners. So I will pass the mic over to y'all.
Thank you so much, Suki, and welcome to everyone here in this session. Today, we're going to be talking about culturally responsive and equitable evaluation to build systems of care. So, next slide, please, Cindy. So, really quickly, I'm Dr. Gia Kelly. I am a change consultant and project director with Change Matrix. I'm also a part of the Intact team, and I serve as the co-lead for the Cross Systems Partnership team, as well as the Director of Transformation teams. And so I'm going to hand it over to my co-presenter to introduce herself.
Hi, good morning, everyone. Good afternoon. Oh, good morning to everyone. My name is Cindy Rivera, and you could almost just verbatim copy over what Dr. Gia just said. I'm also a change consultant and project director with Change Matrix, and I serve on as a TA specialist at NTAC. And co-lead the Cross Systems Partnership team. So it's wonderful to be here, and we're excited to present you all with this knowledge of CREE.
Thank you so much. Thank you. All right. So our agenda today is pretty straightforward. We want to tell a little bit about what we'll discuss today. The first is we're going to discuss equity as the foundation of CREE, and really making sure that there's some level setting around when we say equity, what we mean. Then we'll go into the importance of centering equity in evaluation. Cindy will then take us into an overview of the CREE model, and then ways to implement and use CREE in your system of care evaluation. So that is our agenda for today. Next slide. So let's talk about equity as the foundation of CREE, which I think is critically important. And we're going to start by doing what we call a chatterfall. And so what we want you to do is to think about the question on the screen. I don't want you to put anything in the chat just yet. I want you to hold off. And so what I want you to do is think of 3 words that you can use to define equity. I want you to type those in the chat, but hold off on pressing enter until I say go. And what we hope to see is a beautiful cascade of all of your responses. So again, we're going to define equity in 3 words, not 5, not 10. Somebody always wants to give me a very robust definition, but just 3 words. So I'm going to give you all just one more second or two to do that. And we'll see that chatter fall in just a moment. And if you have your 3 words and you're ready, go ahead and put some emojis up. Let me know that you have those 3 words. There we go. We see some hearts. Okay, now press enter. Let's see what we have. Meets personal needs. We see fair value worth. I see same for everyone. Fairness, justice, recognition. Love it. Fair to all. All have access. Great. Fairness for all. Equal outcomes. We see a lot of fairness, unbiased, right? Appropriate provision, opportunity. Love that, Rebecca. Access for all. Justice, fair, leveled, beautiful. So all of these are wonderful descriptors or definitions for equity, right? Let's see. Resources for all. Love it. Love it. Love it. So thank you all for giving me your idea and your definition of equity. And so let's look at a more formal definition as we move forward. And the definition that I am going to share is Change Matrix's guiding definition of equity that we created as an organization in 2019. And we define equity as everyone, regardless of who they are or where they come from, having the opportunity to thrive. Equity requires acknowledging root causes of inequities, eliminating barriers, lifting community strengths, and relentlessly pursuing justice. So that is a very comprehensive way to define equity. And if you notice in this definition that we don't just stop at providing everyone what they need to thrive, right? That is typically what we hear. But true equity goes beyond that. And it really looks at how do we address root causes? How do we bring in this idea of justice? That is really a comprehensive way to view equity. And so in the chat, just let me know what about this definition sticks out. Is there a word that sticks out to you? Is there something that you maybe have never saw before when you thought about the definition of equity? You can just put that in the chat if there's something that sticks out to you. Okay, I see it. Community strength. Yes. Justice. Yes. Thrive. Yes, relentlessly pursuing justice. Absolutely. Absolutely. So that is our change matrix definition. Next slide, please. So you all may have seen this, what I like to call the justice tree. And there's so many different graphics that talk about the difference between inequality, equality. But I really like this one. I really like this imagery because it doesn't just stop at inequality and equality, but it also includes justice. And I do see some questions in the chat or comments related to how we define justice, right? So in this graphic, we can see at the top left that inequality is really is talking about unequal access to opportunities. And I want you to pay very close attention to the graphics as they change, right? And so when we talk about equality, we're talking about the even distribution of tools and assistance, right? But what we see in the graphics is that the tree still looks the same, but we begin to provide equal ladders for both parties. And we can still see that even when we provide equal tools, someone is still not able to reach the resources. Somebody is still not able to get what they need, right? And so that graphic beautifully shows that to us, that even with equal resources, someone is still left out. And as I'm talking, feel free to put in the chat what you see, what you can see as we go through these graphics. And then we move down to equity, right? And with equity, there are custom tools that we provide to identify and address the inequalities. And so we see in this third graphic that the tree has not changed, right? But the tools have been customized, the ladders have been customized so that both parties are able to access the resource, the tree, right? And in this graphic, I want you to look at the tree as the system. Think about the system of care. Think about whatever system that you are a part of. And so we can see that now each party is able to reach the resources, but something's still off. Something's still off, right? But then when we get to justice, we can see that the tree, the system has been addressed, right? It is now no longer leaning towards one person. It's not partial to one person, right? And not only has the tree been corrected, right? The fruit is more plentiful. Why is that? When the tree is fixed, there's more resources. Wow. Why is that? And we can all have probably our own understanding of what that is. But we see that the true goal is not just to get to equity, but it's really to get to this place of justice. And justice is defined as fixing the system to offer equal accesses to both tools and opportunities. And my thought about the tree becoming more plentiful is that when you fix the tree, you also are able to see where there are populations who are underserved. And so we don't have all of these wonderful resources on one side, right? On one area, in one population, in one community, but they're the same all over the tree, right? So feel free, you can Google the justice tree and feel free to utilize this in your conversations, because I think it's a really great way of talking about equity and justice. Next slide, please. So we're going to talk about the importance of centering equity in our evaluation, right? And I love the commentary that you all gave about the justice tree. Beautiful thoughts about what it means in our system, right? To be able to fix the tree. So why is it important to center equity in evaluation? And for some people, it might be a no-brainer, but we want to acknowledge the fact that the systematic and intentional process of gathering and analyzing information to inform decision-making is a critical part of evaluation, right? Evaluation also helps us to answer questions about the activities, the characteristics, and the results of the work that we're doing, right? If evaluation also includes giving us information, right, that we gather as data, that is a part of evaluation as well. That data can then be numbers, it can be surveys, it can be stories, it can be pictures, it can be a very diverse qualitative and quantitative data can be used in evaluation. But evaluation helps us to know, is what we're doing working? Right? Not just because we think it's working, but what is the data showing us about what's working? Next slide, please. So when we talk about evaluation, it's important to understand that culture is an influence, right, to our evaluation. We must be intentional about including culture and its effects in the evaluation process, right? Many definitions of culture exist. We might have various ways that we define culture, but we can really see culture as the integrated pattern of thoughts, of communications, of actions, of customs, of beliefs, of values, and institutions, right? And so when we think about culture, we're also thinking about racial, ethnic, and linguistic groups. We're thinking about religion, spirituality, biological, and geographical characteristics. Also, sociological characteristics. So all of this is what we bring into this definition of culture. And so we have to think about culture, because there's a danger in just having one story, because people are not a monolith. A group of people are not a monolith. You can talk to a group of Latin folks, and there's going to be different stories and different experiences, although there may be some similarities. And so in our evaluation, we don't want a single story. we must seek to, have diverse perspectives. And that includes both lived experience, right? Those who have lived what we're trying to examine, but it also means bringing other perspectives and other levels of expertise, right, into our as we're looking at the data, as we're trying to formulate a narrative, right? And writers must tell their own stories. So having lived experience at the table is so critical. We also, when we think about considering culture, we have to have more knowledge of the fact that our results of our evaluation are valid. And so that is the process, right? Being guided more by just norms, right? We have to understand that it's more than norms, but that we are authentically sharing a group story, right? That we are respectful and responsive to those who are involved. And what we believe that if we do this, that this will improve the overall effectiveness of our work. And so we have to think about the way that culture influences evaluation. All right, next slide, please. So we can't talk about evaluation without also talking about the ways in which evaluation can and has harmed communities. This is why the CREE model and thinking about culturally responsive and equitable evaluation is so important to the way that we do evaluation, because some of us might think we're evaluating. We are just trying to see if things work, but we all come, even as evaluators, into this work with a lens. Right? We all come into it with our own lived experience, and that can really bring a level of bias into the work. This is why diverse perspectives is so important. And so we can look at the history of evaluation and even now and see that there's been harm. And so you might say, Dr. Kelly, how have we harmed communities? I'm glad you asked. Right? We have created community or group level stereotypes based off of our data. The purpose of evaluation and who is behind the funding can be harmful, right? Doing it to benefit us as a system and not the communities. There can be a lack of understanding and respect to cultural and social norms, right? There can be a lack of privacy or confidentiality that can be harmful. Language justice and its role in informed consent can also be harmful. Implicit bias, like I said, we all come in with our own biases, regardless of how woke or how informed we think we are, right? We all have a bias. And then study questions and design may lead to negative affective states like anxiety, depression, guilt, shock, loss, or self-esteem. And so even the way that we question those from the communities that we are evaluating or the programs can be re-traumatizing or re-triggering. And so those are just a few ways that evaluation can cause harm. Next slide. So equity in evaluation, it really requires that we align our practices with an equity approach. And so we've already defined what equity is, right? It's giving customized tools and resources, but also addressing root causes and fixing the system. And so we must center our evaluation in that equity frame, right? And even more powerfully, using evaluation as a tool for advancing equity. So it's not just about centering equity, but how can we use the data? How can we use what we learn in our evaluation to be more equitable, right? Evaluation should answer critical questions about the effect of our program or intervention on the population, right? Underlying drivers of inequity, our data should tell us where the inequities lie and hopefully what is the root causes of these inequity, and also why history and culture might be affecting the work and potential changes. Lastly, evaluation design and follow through should be based around the values of equity, meaning multiculturally valid and set toward participant partnership. So those are just some of the ways that we can center equity and use in our evaluation and use evaluation to advance equity. Now I am going to pass it over to my wonderful colleague and evaluator, Cynthia Rivera, to take us deeper into CREE.
Thank you, Gia. Thank you so much for providing that foundation that really allows us to think about why are we here? Why are we thinking about evaluation and equity together? So I'm really going to delve deeper into what is culturally responsive and equitable evaluation. Where did it come from? And how might we start thinking about applying it in our own systems of care? Please continue to ask questions in the chat. Gia and I will both respond along with Suki, our host, as we can. So what is CREE? So I'm going to read you the definition and tell you a little bit about where it came from. So culturally responsive and equitable evaluation requires the integration of diversity, inclusion, and equity in all phases of evaluation. CREE incorporates cultural, structural, and contextual factors using a participatory process that shifts powers to individuals most impacted. It's not just one method of evaluation. It is an approach that should be infused in all methods of evaluation. And CREE advances equity by informing strategy, program improvement, decision-making, and policy formation and social change. Something to think about is there's really three concepts that are key in CREE. The first is the importance of current and historical cultural context. We are really centering culture. We're trying to understand where our communities are within a cultural context. The second thing is inclusive and participatory evaluation practices. Some of you may have conducted community-based participatory action research or something similar. That's part of it. That's a little bit of what we're talking about. But really, the third key piece is how are we advancing equity? How are we centering equity as a part of our evaluation conversation? How are we ensuring that our results are ensuring that what our programs are doing are advancing the equity of our participants, clients, and communities? And CREE, the definition in and of itself was developed kind of using this approach. It was gathering evaluators through our Expanding the Bench initiative, which I'm going to tell you more about, to arrive at what is this definition of CREE and what should be the key concepts that support it. So I was just taking a look at the Q&A. So I want to pause and think a little bit about systems of care and how our systems of care and our framework around system of care actually align quite nicely to what CREE is and CREE does. The first thing I want to do is there's actually a poll up on the left side. If you see where the three little, like the bar graph is, if you click that, oh, I have to publish the poll. Okay, I'm going to do that right now. Is everyone able to do this? So I'm asking, what is your role in system of care? I just am curious. We have program directors, we have some coordinators, evaluators, mental health service provider, peers, case. We have a little bit of everything. We have a lot of evaluators, about almost a third. Oh, no, going down. I just kind of wanted to see where we are at as we come into this conversation. What I don't want this to be is a conversation that we think is only for evaluators. CREE is for everyone because culturally responsive and equitable evaluation should be involving everybody who is impacted by the research. I'm going to go ahead and close the poll. So it looks like we're almost at a quarter, and then And then we have some service providers and peers. So I'm now going to close that, and I don't know what happens next. Okay. Can you see the slide deck again? I'm going to check my. Okay. So looks like you all can. So in our SOC, many roles, right? Some of us are evaluators, some of us are program coordinators, some of us are directors, some of us are providing services, or our peers, or our outside agency providing supports. So how does this all come together? Well, first of all, there are actually 13 principles of system of care that support the thinking around addressing mental health and the well-being of young people, right? I'm not going to go over all 13. In the resources, you can find the link to the Evolution of System of Care document that outlines them. I am going to highlight these 3 that really align very well to what we're talking about with CREE. So it really makes the argument that, yes, we should be looking at CREE as an approach to evaluation and system of care. The first is partnerships with family and youth. So this is ensuring that we are centering youth and families in the design of SOC, in the governance, in system implementation, in evaluation, and quality assurance, right? Where families and youth should be front and center as we build our system of care, which includes evaluation. The next thing is mental health equity, which is providing equitable services and supports that are accessible to young people and their families, irrespective of race, religion, national origin, gender expression, sexual orientation, physical disability, socioeconomic status, geography, language, immigration status, or other characteristics. We want to eliminate disparities in access and improve quality of services, and make sure that our services are responsive to all of the youth and families that we're working with. And finally, we are trying to incorporate data-driven accountability, right? And this means that we are continuously monitoring for accountability, quality improvement, to track, monitor, and manage the achievement of our goals, our fidelity to the SOC values and principles, and the utilization and quality of clinical services and supports. That's what we're trying to do with SOC. That's 3 of the things we're trying to do. And it aligns very nicely to what CREE is all about. I also appreciate all of you that added in your role in system of care to the chat. So it's really indicative of like all the different people that see value in this conversation aside from just evaluators. So I'm happy that you're all here. So let's dig in. We have 10 CREE principles. And like I said, slide deck is in the resource tab, so you can look a little bit more into these. But there are 10 fundamental truths to committing to CREE. The lens which all of our evaluation activities are conducted in diverse communities. As we continue to support and think about CREE, it is important to be informed of principles that can be used to guide your practice. These are guiding principles. Nothing is hard and fast. There is no rule, there is no checklist for CREE, because we are being responsive to our community, and we are taking, we are ensuring a lot of reflection along the way. So as we look at these, I'm going to kind of highlight some of them. We're recognizing that it as social justice. So evaluation is social justice. We're recognizing that we work in diverse, cultural, contextual, and complex communities. Goes back to what Dr. Kelly was saying, is that there is no one lived experience. There is no one viewpoint that should guide our efforts or should be centered, right? All of what the entirety of our population is who we need to include as we explore our evaluation. We're integrating culturally responsive practices and applications throughout the evaluation cycle. We're being sure to correct the narrative. I'm almost 20 years into being an evaluator, which always blows my mind when I say this. But I think of some of the early evaluations I was a part of, and when sometimes data may have been misinterpreted and it never got corrected, and the harm that may have done on communities. It actually made me feel not great about being an evaluator for several years. But I came back to the field when I could come back in a more justice-oriented way, which is through CREE. So, but the responsibility we have to correct the narrative and helping people to understand that one data point is just that and does not tell that whole story is really important. And as people that have that responsibility and are writing up reports, it's really important that when we can, we ensure that our narratives are truthful, representative, and that our communities have had a part in writing those. We're acknowledging history in CREE. We're addressing disparities. These things we can do with partnering, with a lot of community engagement, as a way to get to all of these CREE principles. We have to look at ourselves. Number 7 is where I'm at, where we're assessing, acknowledging, and addressing your own biases. So what did you come into this project already thinking about systems of care, children and families involved in system of care? What does that even mean? So, and taking that time to rethink about that as your knowledge grows and you become more informed by people within system of care. We commit to the community's power, judgment, and input. We will talk about power and making sure that we address power differentials and ensure that when there is a power differential, we acknowledge it and we work for ways to even out that. And then we make equity the foundation. This is my favorite thing about CREE, is that it centers not the needs of the project, not the needs of the funder, but really equity as the foundation for this evaluation work. And then finally is to lead courageous conversations and advocate for CREE. If you're hearing some snoring, that's my pug, who is very, very loud. So sorry about that. So any questions or reactions to those CREE principles? I'm actually going to go back to see if there's anything. Oh, someone put a picture. Unfortunately, my pug should be that weight, and he's much, much larger than that. So, okay. That's pretty funny. Okay. What makes CREE different? Again, equity, equity, equity. That's what we're here for. That's what's driving our research, our evaluation. CREE prioritizes community voice and lived experience. We also recognize that context will inform the process. So we're not going to jump into, okay, this is our evaluation plan, this is our timeline, here are the surveys, here are the tools, and this is how we're going to get it done. We're going to pause and we're going to spend time thinking about what is the cultural context of the community we're working in, and what, how might that inform our process. Finally, we're transparent, because CREE requires informed decision-making, collaboration, and co-creation. You cannot accomplish any of those things without being transparent. And then CREE requires an investment of time and effort and an investment in the people that are part of your evaluation and helping to inform it. We're all about building collaboration through trust and positive relationships. That's a big part as a CREE evaluator that you're going to work on. You know, you might spend a little bit more time building the trust and evaluations and relationships than you might be reviewing, you know, possible tools you may use in the beginning, you know. And it's co-creational. So you may have community members, project directors, coordinators, participants, co-writing, reviewing findings. Okay. Any questions? I'm going to keep it moving. Okay. We already talked a little bit about why equity matters in evaluation, but we're going to talk about it again because equity really matters. I think if you've ever worked on a university funded or, you know, a research project that involves human subjects, I think about this and like why we all have to go through human subjects training and ensure that we all have institutional review boards reviewing our research. And that's because of all the harm that has been done in research, some intentional, but some is unintentional. And so we want to really think about why equity matters. And one of the things is that we're working to produce findings that accurately reflect and incorporate the life experiences of those being evaluated, not those who are the evaluators or funders of the evaluation. I think about this a lot as an evaluator and how many times I have worked off, you know, an evaluation plan or an RFP that was very much driven by the funding source and thinking about our evaluation question in terms of the funding or the program versus what makes the most sense for the community. And that's the key here. How are we centering the community needs in our evaluation versus, and this is so hard because we all need funding, right? We all need to be paid to provide evaluation services. So how do we start having those conversations and how do we get there? So we want also to acknowledge that multiple human truths can be valued and valid, right? That's why we want to bring in so many perspectives. That's why we want to involve so many partners in CREE, is because all of those perspectives are valid when we're performing evaluation. Being equitable in learning agenda development means identifying the learning questions we should be asking about equity, right? Asking intentional questions about equity. It means being deliberate about the learning process itself. Okay. I think we should highlight there's this, I'm sorry, I'm not even in the Q&A. Okay. Do you have any examples or side-by-sides of an evaluation plan and how it is done and what changes with the CREE framework? I do not have that in this slide deck. However, I'm going to give you a slew of resources that will help to further your understanding of and how you may include the CREE approach into your evaluation plan. So it may be adding steps in, like community engagement. Like, when are you going to do that? way up front, right? Versus oftentimes we may submit a proposal for evaluation plan and already have or an evaluation and already have a timeline in. That's not the correct way. That's not the CREE way, because we're going forward without consulting the community, right? Okay. I'm going to go ahead and shift. So what are some CREE strategies? So these are strategies that you can think about incorporating into an evaluation plan. So you're going to use a culturally responsive and equitable lens throughout the evaluation process. This is being reflective. You know, this is stopping, pausing, and thinking about who was at the table, who did we survey, or have key informant interviews with, or focus groups. So building into your evaluation plan the time to pause, to make sure that we were equitable in who was brought in is really important. I understand that in SOC, or if you're a CMHI evaluators, there's going to be some things that are just must-dos. But so some of this may be in addition to what you're already doing, and a slow evolution towards how do we get there overall in SOC and federal evaluations. We have a way to go, but we're working on it. The other thing is form relationships and ensure representation of vulnerable and marginalized groups, address power differences, and ensure language issues are addressed. I can say as an evaluator that the time I was able to do this best was actually with youth. And we were able to bring youth in before we designed a program and before we decided on evaluation tools. And we really had them guide us through the process. And this was hugely successful. And so we also need to think about in SOC, when we're working with youth and families, who does that mean? Who does that mean needs to be part of the representation of groups that may have been marginalized in the past? And then finally, take the time up front. What is the cultural context of the community you're working on? Conduct a contextual analysis that is going to understand what other historical factors may be driving some of the data you're seeing. So these are all things you can build into an evaluation plan. Oh, look at this. Adapt evaluation plans based on input from members of vulnerable and marginalized communities. You're going to be in conversation, a lot of conversation with individuals with lived experience as part of your CREE approach. The conversation isn't a one-time thing. It's going to be continuous, and you're going to be re-engaging. You're going to be reflecting on what you are seeing, and having further conversations again as the steps of your evaluation plan move forward. You're going to ensure data are collected throughout the full process, and these are analyzed through a cultural lens. You adjust program and evaluation as necessary, even when it slows you down. So I always say, we'll go as quickly as we can, but as slow as we must, to make sure that our narrative is correct and that all people who have a stake in this and may be impacted have been consulted. And then we involve community members in analysis and data and build capacity when possible. So isn't it great when we can when we can help someone build skills they didn't know that they might have? This could be training, on how to conduct focus groups, that can be getting members of your community human subjects trained. That builds capacity. That's value added, if it's something that the community indeed would like. And then this is kind of the CREE learning cycle. And something to think about here is, again, it's not a checklist. It's a journey. It's reflexive. It's thinking about what we may be bringing as biases, as the ways we've been trained as evaluators to value certain data and certain stories or tools above others. It's really re-examining that over and over again. So you have to ground yourself in who you are. Who are you as an evaluator or a program director or a program coordinator? And how does that inform your perspective of your system of care? Of your system of care evaluation. And then it's that continual learning. So you can educate yourself on CREE. And then again, always, what's the context here of this community? How can this influence our evaluation? Community engagement, engage with others. As someone who's done both evaluation work and community work for years, this is building relationships. This is getting in there and, getting out of your office and having those real conversations, real connections, building trust with people who are, who may or may not think of themselves as having a role in this evaluation or in your work. And looking at who are the traditional stakeholders and then who may not have had a seat at the table but should be there. Then we're going to keep applying our learnings, our practice. You're going to learn along the way, right? Culture shifts dynamically, daily. So that means that the context of how you're performing your evaluation is going to change continuously. And then reflect. This is a big piece, like that reflection, asking for feedback and trying to improve your practice as you kind of work through this CREE learning cycle. So let's talk a little bit about okay, where's some practical ways I can do this? So we're going to do that next. So using CREE in your system of care evaluation. So first off, we may have, and this may not, this is a confession. I've never evaluated a system of care. Lots of other evaluations under my belt, not this. But so we start with our standard kind of thinking around evaluation. And we ask those things like, okay, when should we start, surveying? When's the program beginning? Should we do a midpoint thing? Should we do, 6-month post follow-up? We start thinking about all of those nitty-gritties, those who, what, when, where, why. And then we really start thinking about, okay, what's our question? What are we trying to answer, right? Maybe that's driven more by our funding source than by the community. And then we start looking at the scope and timeline. What do we have the resources to do? What do we have the time to do, right? So it's those really, really logistical things that we start. So a CREE-informed practice may look a little bit different. We might start with, again, I'm going to say it again, that cultural context. So what are the experiences, the history or concerns that we might have about this evaluation? What are my own, Have you ever been thrust into something and the program's been going for 4 months and you're suddenly there as an evaluator? You're like, oh my goodness, we're behind. We got to play catch up. That's okay, but we got to center ourselves and figure out, well, where does that leave us? What can we do? Now, and then we think about, well, whose experiences are we centering? When we're looking at, tools and interview questions or focus group questions, whose questions are we centering in this? Is it the evaluators and the programs, or should we move towards our youth and our families? And then we always need to think about who is the most impacted by this evaluation, and how can we most support equity in this process for this group to get to, the tree and the ladders and all the apples being equal that Gia showed us. That's where we're getting at. That's where we're part of that. As an evaluator, as other people that support evaluation in systems of care, we can help with the justice tree. That can be part of our role. And I encourage you all to take that on. So what are we actually have through Change Matrix, tools to get you there, tools to support you. The first one is our Expanding the Bench initiative. CREE came from Expanding the Bench. And what Expanding the Bench recognized is there is a lack of diverse evaluators in the field. And the vision is to expand that, to strengthen, diversify, and increase access to racial and ethnically diverse evaluators who have been historically and or are presently underrepresented or marginalized, and who practice CREE. It's very focused. We want to make sure that we are building a network of evaluators who are using the CREE approach as part of their evaluation practices. We support this by not only supporting people learning about CREE, but also building networks and connections between CREE evaluators and funders. So that's one way, and we are going to move on. So any of you evaluators out there, whether it's a full-time job or not, we have the Advancing Culturally Responsive and Equitable, the ACE Evaluation Network. So this evaluation network brings together racially and ethnic diverse evaluators that are committed to CREE and pulls them into one network and allows you to kind of be highlighted as part of our network. And when people are looking for ACE evaluators, CREE evaluators, they can search a database and get to you. So as part of this, you need to identify as an evaluator part of a racially or ethnically diverse group, reside in the US or a territory or a sovereign tribal nation. You need 7 years of paid evaluation experience and knowledge and experience in CREE. So it's really cool. This is what our database looks like. So you would, if you're a funder, if you're a program that's looking for an ACE evaluator, you can search by state, you can search by type of evaluator, qualitative, quantitative, and get a whole list of people that might fit the bill for you. If you are on that end of, hey, I would like, oh my goodness, we're almost out of time, an evaluator. So I'm going to skip through this because the last thing, CREE Learning Series. So there's a 4-part series that you can be a part of. Registration is open now, and this summer the learning series starts. So you will get much more content around CREE. You'll get to hear from the people who came up with the definitions. You will get to have live discussions with evaluators who are currently practicing CREE all over the US. And you're really going to understand that difference between the CREE approach and non-CREE approach. And it gets you positioned to really go out and practice CREE. I was able to go through it. It really changed my own evaluation practice and made me excited to be an evaluator again after kind of being a reluctant evaluator for years. This changed my perspective, and I really encourage you all to look at being part of the learning series. It's in the resources. The links are there. I wish I could talk more about this. Oh, here's another slide on the CREE learning series. We have to wrap up. Last slide. Anything that you would like to share in the chat or just think about for yourself that was new information that you learned from today? Anything that you can take from today's presentation and apply it to your own work in SOC. But with that, we are kind of, there's a resource slide, and all the resources are up already populated in the resource tab. But I want to thank NTAC. I want to thank our host Suki and Gia, Dr. Kelly for her partnership in this, and hope that if you have any questions, feel free to LinkedIn me. And I hope that we've brought some new information to you all. Thank you.
Thank you all so much. I think we have just a couple of minutes for any questions for our fantastic presenters, Dr. Gia Kelly and Cindy Rivera with NTAC and Change Matrix. I believe that the speakers are going to be kind of clearing up the Q&A in this last couple of minutes and capturing any questions that can potentially be followed up on afterwards. And so I would love to remind folks that we have a, oh, and Sarah, I see that you have raised your hand. Unfortunately, we're not using the raise hand function in this session, but if you'd like to drop your question in the Q&A, that would be great. Just wanted to make sure you knew I saw you. So as we're closing out this session, would love, I learned so much and I encourage you all to dig deeper into the topic of CREE in your own time, attend that training that Cindy talked about that Change Matrix is offering, and potentially become a part of that ACE network. Really good opportunities. So just a little reminder that we are about to move into a 30-minute break. And after that, we are going to hear from our first keynote speaker, Dr. Tanisha Freeman Foster. We'll be exploring the individual, interpersonal, and organizational factors contributing to mental health disparities among Black and Brown youth and young adults. And you will discover actionable steps to fostering caring and equitable systems in collaboration with our communities, aiming to eliminate disparities and create meaningful change, which I think is a great kind of continuation of this conversation that we've just had today. So just thank you again for sharing your time, expertise, and experience with us, Dr. Kelly and Cindy. And thank you all so much for being here. We had over 100 folks in this session, and so glad that you all chose to share your time with us today. And in case I did not mention it, we have a daily evaluation that will be available on the platform on the main page. And so we invite all of you to please complete that each day. We actually look at that evaluation data. Speaking of evaluation, we look at it every day at the end of the day and take all of that into consideration to make improvements moving forward. Thank you all so much.
Thank you.